Hello, everyone. Here it's Harminder Singh and Michelle Alfa. We're going to talk about our study, which looked at impact of cleaning monitoring combined with channel purge storage on elimination of E. coli and environmental bacteria from duodenoscopes. I am Associate Professor of Gastroenterology at University of Manitoba.
And I'm a professor in the Department of Medical Microbiology, also at the University of Manitoba. So Harminder, maybe you can start us off. What do you think are the reasons why this study was actually needed in the first place?
So, there has been a lot of outbreaks which have been reported with resistant organisms, and the infections and transmissions of infections with the duodenoscopes has become an important issue. These procedures are important. Nevertheless, it's important also to prevent the risk of transmission of infections. And there have been lots of different ways of trying to eradicate these risks. And our hypothesis was that monitoring the cleaning plus monitoring and making sure the moisture does not remain persistent would prevent the risks of transmission of the infections.
And I think one of the interesting things was that the gram-negatives were completely eradicated, even though we did up to 50 rounds of repeated testing on an individual scope. And it suggests that taking the approach outlined in the manuscript, you should be able to prevent the outbreaks of Enterobacteriaceae, especially the multi-drug resistant ones, if this approach is taken.
I completely agree. I think it's the gram-negatives are the most important organisms, and the outbreaks have been mostly reported with the gram-negatives, and the gram-positives, some of them are pathogenic. However, in the low levels which persisted in our study, we really don't know what their implications are. Small amounts of the persistent bacteria, they're around us, and they may not necessarily lead to infections. And the cutoffs which have been described are more or less arbitrary cutoffs. Whether those levels are important or not needs to be further worked up. And in the interim, using the methods that we have described, seems to be highly effective in preventing gram-negative infections.
And I think it supports some of the recent clinical studies that have come out that basically showed there was no significant difference in contamination rates of duodenoscopes, regardless of whether you did just one round of high-level disinfection, or you did 2 rounds of disinfection, or you looked at disinfection, high-level disinfection combined with ethylene oxide sterilization. So I think it helps provide clinics with a sense of knowledge that if they take the 3 key components that we've outlined in our study, hopefully that indicates a reduced risk that they're going to have an outbreak with a gram-negative.
I think that's a great point. And I would also want to emphasize that there are chances that some bacteria would persist. The gram-positives persisted even though the gram-negatives were eliminated. So I think we as the endoscopists still need to be cognizant that there is some risk, even though that may be low risk, and the procedures, the ERCP-related procedures, really should not be done for diagnostic reasons, especially when there are other modalities such as the MRCP and EUS, which are available and which serve as good diagnostic procedures.
So do you think there should be guideline changes that could be reflective of some of the key findings that we had?
I completely agree. The findings that we found, it's effective, and hopefully others will also document and provide similar results as to what we have found. And that being the case, The guidelines should incorporate what we found and needs to be done, i.e. monitoring of the cleaning, and then storage in the channel purge cabinets. And this, of course, is after properly following the manufacturer recommendations for cleaning, which are extremely important. And as you and I have talked about many times, I mean, I think the initial process of following the cleaning as is recommended is extremely important. If that's not done, no matter what way is subsequently done to reprocess the scopes, there's likely going to be some persistent organisms. So it's important the cleaning be done and as the first step.
So, kind of, what would you summarize as our conclusions in a nutshell from this study?
So, the important thing is the gram-negative contamination can be eliminated as long as the manufacturer's recommendations are followed, the cleaning is monitored, and the development of the moisture is prevented. And of course, the procedures be done when they're clinically indicated. And of course, there's no need of not doing them when they are clinically indicated.